By the time the quiz session is getting ready, I will request all the participants to please be seated in the front row so that it is easy to conduct the quiz. All the participants are requested to please take the first row.
So, am I audible? Yeah, is it audible? Great. So, I think we had phenomenal discussion about diastology and all these problems. I think everybody's settling down. So, why are we here? Are we here for learning or are we here for money? I think priority is money, right? So, as I have been told, we have got exciting cash prize. Am I correct? How much is it? No disclosures. Okay, we'll tell after 10 questions. They will not be dissatisfied. Okay, so it's all about money. It's not Jeopardy. I'm going to. I'm just. Is Dr. Mohan coming? Yeah. Okay. Okay. So it's going to be quick. So I'm the quiz master, but I'm not the lady here. And we have Dr. Dipankar Datta and Dr. Rajat. They are the educators. I will be waiting for Dr. J.C. Mohan, and he's just gone to the restroom, and Dr. Satish Govind, they are the referees. Till the time they come, I will like to tell you, I hope everybody has got a paper. Please write down your name, your mobile number, and your email address. Your name, which you can read, which we can read. Okay, there is somebody who's asking for some paper. Are they qualified to take? Yes. First node is not qualified. Okay, there are people coming in fast. Come in. Okay, you're a cardiologist. You're not qualified. Okay, so please write your name, please write your email address, and please write your phone number so that if you get money, Dr. Mohan is going to the referee. So, Dr. Mohan is always going to be correct. You cannot challenge him. If he has doubt, I am correct. You both cannot challenge. Nobody can challenge both of us. That is the first rule. Please write the best possible answer which you know. We have 20 questions to be answered. You 2 correct sheets are going to get only money. There is nothing else than money. Okay? The stakes are high. You will get 45 seconds to write your answer. And after 20, okay, somebody is coming. Did you get the paper? Okay, please come in. Are we ready? Everybody is ready? Acha, paper dao. So how much is the cash prize? After 10 questions we will tell. Okay? Few people are joining. So everybody, sir, Dr. Mohan, people are only playing for money, not to learn. Everybody wanted some money.
You know, anything you do, the human beings always need to be incentivized. Without incentive, they don't. Even learning, you have to do. As a child, you learn because you want to please your parents.
Parents, okay.
And of course, at your age, you learn a lot because maybe you are trying to please your wife.
Right.
Who knows?
10 plus 7. 10 or 10.
Okay, you already, everybody. So are we ready? Everybody is got? And remember one thing. Please write 1 and answer. Please write 2 and answer. Dr. Dipankar has said if you write 2 and then answer the third, the answer of third in 2, you will not get the marks. Remember, there is no negative marking. So I am going to put the first question. And please, you are allowed to see the next person who is sitting next to you. So the money will be shared. Don't worry about it. We want to do it. The first question is, which month is celebrated as the Medical Ultrasound Awareness Month? This came 1.5 years back. You can write your birthday month. If you don't know, it may coincide. But if you know, you can write. No, you cannot Google. Please, please. That's a request. Okay? Yeah, that was one of the rules. Don't Google, don't Snapchat. So please write the whole month. Okay? Moving to second question. There are a mix of simple question, difficult question. In which phase of cardiac cycle? You have multiple choice. A diagnosis of number of cusps of aortic valve is done. Is it mid-systole, late systole, early diastole, late diastole? Number of cusps, whether it is quadricuspid, bicuspid, tricuspid. You know in which phase of cardiac cycle. I hope you can write the answer. There is no fifth choice. You have to write the answer. Don't write 1, 2, 3, 4. Write the answer. Okay? Let's go to the third quiz. Third. लिख लिया सबने? शोभरा लिखे नीचे? Right? Okay. The third one. Please see this tracing. This is a transesophageal image. What is shown in this flow pattern? What is shown in the flow pattern? The answer, there are 3 things in the answer. If possible, write all the 3 of them. I mean, Dr. Mohan can get 5 of them, but we want 3. What are shown in this Doppler flow pattern? He's very happy. Either he knows or he doesn't know. We'll just keep it for 10 more seconds. The only hint is this is a transesophageal echo. Can I go ahead? Are you still thinking you want to write? Can I go ahead? Go ahead. Okay. The fourth question. In this Doppler, what are we seeing? What is this phenomenon called? You have to write the phenomenon. It's a mix of simple and difficult question. Doppler tracing, we need the name of the phenomenon. Some pens are writing, that's nice. Dr. Aniruddha Dibard, he's the first, right? He cannot write, okay. Okay, let's go to the fifth question. It is not out of the course, it is from the course of this conference. What is this index? If somebody has attended morning's session, Dr. Mohan has taught us. Name this index. Sir, no prompting, please. Okay, can we go ahead? The sixth question. It's not a Doppler, it's a structure. What is the structure in this picture which is pointed? It's not a Doppler, it is a structure. There's a typing mistake. Where are we pointing? What structure is being identified? These are simple images on a day-to-day practice we should see. So this is question number 6. Answer should be in front of 6. Okay, good. People are still writing. Moving to 7th question. Again from the book. This is the Doppler's interrogation. You have to write both the answers. What is the site of interrogation and for what condition do we do it? What is the site of this Doppler interrogation and for what condition you are doing this interrogation? No prompting, please, sir. No prompting. Coming to the 8th question. Again, from the course, we do something to identify something. So, with this, which condition can be diagnosed? Sir, easy questions hai na? These are easy questions. Good. Okay. We need you to earn some money. The organizers want you to earn some money. This is the 9th question. Please identify this cardiac structure. Ninth question, what is the cardiac structure being shown? I'm slightly surprised why the photographs are being taken. Okay, that's nice. Okay. What happened? I don't know, something closed. Okay, one second, I will restart it. So we have 9 questions. I'm just being careful not to give you the answers. Yeah, okay, I have got it. Okay, I'm just starting it again. Now this is the 10th question. This is a formulae. What can you derive with this? So if you apply this formulae, what do you get? So the second runner-up, the first runner-up is going to get 7,000. And the winner is going to get 10,000 rupees by check or hard cash? Check. By check. And it is going to be bearer check or a check is going to get bounced. I'm just kidding. So the point is 7,000 and 10,000. Oh, okay. Okay, so this is a little bit of fun. I don't know whether it plays or not. Let's see. If it doesn't play, we'll just move on. Okay, the 11th question. This is an apical long axis view. of a disease, there is a specific sign. See, the quiz is for learning also. It is not only for money. So what is the disease you can suspect from this apical long axis view? So if you are writing something, right, there are no negative markings. But if you are taking pass, remember, this is the 11th question. Can I move on to the next question? What is being shown? I don't know why the images are not playing now. Yeah. There's an artifact which is shown. What is the name? Which imaging artifact are you being shown? Remember, after the 11th question, things are going to get slightly. We are not going to give you money easily. We want you to work. Which imaging artifact is being shown here? This is not out of course. Can I move ahead? So after 20 questions, we are going to get 1 minute to write down, and then we are going to snatch all the papers, correct? It will snatch all of them. And the quiz is, this is the 13th question. What are you seeing? What is your diagnosis? What's happening here? We need the complete diagnosis, please. If somebody writes it's an intrauterine baby inside the left ventricle, I can, huh? That's a broad hint. So the baby is dancing, calcified baby is dancing in the left ventricle. If I tell something like that, the PNTD guys will take me out. Okay, 13th question. Have you guys written? We need the complete diagnosis. Okay, slightly easier thing. Again, this was discussed today morning. Describe the sign on tissue Doppler. What is the name of this sign? Let's move on to the next question. This is an M mode. So we were discussing the use of M mode today. If we apply M mode, what do you see? What is the diagnosis which you can make on M mode? Please see the image completely. That's the hint. M mode diagnosis helps in identifying this. Okay, can I move on? Something new to learn today. Telu ki hocche? What is Telu? What is the full form of Telu? Very important. Hint is, it is the future of echo. It is now being done. Because it has 4 characters, we should spend 10 seconds. You can see on the left side, you can see on the right side, whatever the others are writing, please you can write. Telu. Okay? There is a pointer somewhere. What is the diagnosis? What's happening? It's a still image. I've shown you a baby. Now I'm showing you something else. Seventeen question, 3 more to go to earn 10,000 or 7,000. Okay, this is easy. We have been doing a lot of GLS, longitudinal strain, longitudinal deformation. But it represents what? Longitudinal deformation represents dash contraction. Fill in the blanks. What are we assessing? We should know what is GLS. So what does it identify? What kind of contraction does it identify? Right? And we come to the end. The next question has 2 parts. So it will be the 19th and the 20th question. I think I had already done it last time, but it is important. That's why we are. See this image. And you have the 19th question and the 20th question. So, there are some changes happening to the lung ultrasound beam. So, what happens from A to B? To frame rate, to line density, the spatial resolution, and temporal resolution. Everything has got 0.5 marks. So, from A to B, the frame rate increases, decreases, no change. Line density increases, decreases, no change. Same for 4. A to B, what is happening? These are the 4 questions you have to fill up. We'll spend 2 minutes on this. Please understand, these are the physics which everybody should know. And we are going to explain it to you when we have the answers. So frame rate changes to something or not. Let's see. Line density, spatial and temporal resolution. Sorry? So frame rate will have 0.5 and marks. Line density will have 0.5 marks. Spatial resolution will have 0.5 marks. Temporal will have 0.5. This is 19th and 20th. So 1 mark each. So A is the basic figure. It changes to B. What happens?
That would be the time.
Yeah. So now if there is a tiebreaker, Dr. Deepankar Datta has quickly identified the question. The question which had 3 answers, I had given you a hint. That is going to decide. So now you have 1 minute to revise all your questions. Please check your name, mobile number, and email. And I need 2 volunteers to বললেই তুলে দেবে আচ্ছা আমরা টেনে নেব কি তুলবো স্ন্যাচ করে নেব আচ্ছা ঠিক আছে ওকে okay they are voluntarily giving so if you can return back so Dr. Deepankar Da and Dr. Rajat are going to see the answers and the prizes will be given tomorrow Pre-lunch. So prizes will have 7,000 and 10,000 and also lunch. So there is an extra bonus. You are also going to get lunch. Okay. So we'll discuss the answers quickly. Let's have all the, make sure once I show the answers, then we will not take any Sir, how do you rate this? It is mild to moderate. The questions? So what should be the scoring, the NEET scoring? Percentile.
The best guy for somewhere around 16 to 17.
Okay, so see, he expects 16 to 17. So almost around 75%. You should get honors. Okay? Okay. Has everybody given it back? Shobra Didi che? Okay. So first question, what is the month? It is October. So the American Society of Echo and the EACVI jointly announced as ultrasound month as October of every year. It will be celebrated as awareness month. Okay. So how many do you think has written, whose birthday is in October? Yeah, did you write October? Good, you're lucky. Okay. Oh, this is the other answer. One second. I have one more. I just. Just trying to get it. $32. Okay. That's nice. You can check it quickly. Yeah, I'm just trying to get the answers. Okay. So I will discuss it with you, everyone. Yeah. This was October. So which is the phase of cardiac cycle? It is mid-systole. Okay. So anybody who has written mid-systole is right. What is the flow pattern? So see the ECG, please. So there is first degree AV block, there is a diastolic MR, and there is an L wave. So this is a CW. However, there is a L wave, there is the diastolic MR, and there is AV block. Dr. Mohan, your thoughts?
No, I think it is complete heart block.
CHB, yeah.
And what you are seeing as L wave basically is atrial contraction, which is pushing the blood in mid-diastole. So you have a atrial kick coming in mid-diastole, pushing the blood through the trans. So patient has actually got complete heart block, the diastolic MR, early systolic MR, and of course, most likely some degree of diastolic dysfunction. We don't know what is the age, but this would come to my
Yeah.
mind.
So if you have written diastolic MR and AV block, you will get it.
So the first beat, what it shows you, triphasic flow essentially is an atrial contraction occurring actually after the somewhere in mid diastole, and producing actually flow from the left atrium into the left ventricle. So this is actually complete heart block patient, not first degree.
Yeah,
AV
it is a
block.
CHB. It's complete heart. So if somebody has written AV block, complete heart block with diastolic MR, gets it. This is annulus reversus, right? In constrictive pericarditis. It's very easy. Dimensionless index. We have mentioned about in the morning about for severe aortic stenosis less than 0.25
So you call it DVI actually, dimensionless velocity index.
index. This was what? Eustachian valve. So somebody is like, अच्छा हुआ, ठीक ऐसा मैंने. There are a lot of things. Did you get it correct or not? Of course. Yeah, great. What are we seeing? Aortic regurgitation, descending aorta, reversal of flow. That's easy. This was HOCM, provocative maneuvers. What is this?
No, you will call it false tendon.
False tendon,
Yeah,
right?
that would be the correct answer.
Sorry? Endomyocardial?
No.
It is not endomyocardial flap. It is a false
This is what
These
we
are
call
false
false.
tendon.
These are all fibrous strands which
strands.
cross across
Normal variant.
normal variants. Therefore,
I don't know why this is
they're
clicking down.
just call it false tendon.
False
that is
tendon.
the way you'll describe it.
Again, my this got fixed. I will just restart. I think there's some problem. No, ninth jaচ্ছে, I think some problem. Yeah. We'll get it back. 1 second.
The name is false tendon. They are
Yeah.
not false. They are true structures. They move from one wall to the other wall, but they are very thin.
Yeah.
And but they are film-like. They are like a fan, you know. So sometime when the fan comes and fast, you see it thicker, and sometimes comes end on, you see it thin.
Yeah. So what is this formula?
Yeah,
This is pulmonary vascular resistance. It has a lower sensitivity, but a pretty good 87% to 92% specificity to identify pulmonary vascular resistance, which is normally two Woods. But
pressure is equal to flow into resistance. VTR represents volume, flow, and the RVOT-VTR represents flow, and VTTR represents pressure. So pressure divided by flow is equal to resistance. Simple.
simple, yeah. Normal is 2 Wood
Ohm's
units.
law, pressure is equal to flow into resistance.
Anything more than 3 Woods, you are dealing with high PVR. What is this?
I don't think you should jump to that. The anomalous papillary muscle actually tells you that you should, for your first possibility should be hypertrophic cardiomyopathy.
Yeah, so this is a hypertrophied heart. No, this is a hypertrophied heart, Dr. Sorry, but there's a binary bright lines. It goes in favor of Fabry's disease. It is not specific of it, but if you say 2 lines which are bright, it is a hypertrophied heart. There are some work which has come. I will just play it. Can you see this bright line? There are 2 lines, binary bright lines. Infiltrative, they can think of Fabry's disease. Of course, this is hypertrophied heart. It is not a echo diagnosis. So if somebody has Written Fabries, he surely gets marked. But, I'm sorry? It still can be hypertrophied heart. So what should we do, sir? If somebody has written hypertrophied heart, what do we do? Do we give marks?
Anybody who has written, whether it is HOCM or oblique amyloid Fabry, give each of them some point.
HOCM, amyloid Fabries, give them marks. Right?
This,
Okay, this is what?
no.
No, this is not aliasing. Any more thoughts? This is side lobe
This
artifact.
is side lobe
Side
error.
lobe artifact.
This is side lobe error. The eccentric AR jet is being seen just behind the posterior aortic wall.
Yeah.
This is actually the side lobe.
Side lobe artifact. Aliasing is in Doppler phenomena.
So side lobe error occurs with Doppler. It occurs with the tissues also.
So we want the complete diagnosis
Emplaza device.
in a patient
ASD
of
Emplaza
ASD.
device.
We want ASD and embolization of the emplads
Into the left ventricle.
into the left ventricle.
And lodged in the left. So you can write complete thing. Okay, good.
Okay, you have a question? Right. If they write only emplads, half mark, but embolize to likhna hi padega na sir. But if they write a baby, no marks. Huh? Displaced is right. I mean if you understand, yes, they can write. What is this? 555 sign suggests you a poorer prognosis, tissue Doppler. Correct. What is this? No.
No.
No. So this sudden cut. See here. I told you, please see the whole image. What is this? Prosthetic mitral valve.
Metallic prosthesis.
Metallic. And what does this
Mitral.
show? If you are seeing an acute, can you see? Open and close. So yeah, you want to tell? Go ahead. No. So it is a normaling functioning prosthetic mitral
You
valve.
need to look at the opening angle and closing angle.
See,
If those are sharp, they are 90 degree, it is a normally functioning prosthesis.
so this is a sharp, sudden cutoff and sudden open. It is a normaling functioning.
Opening angle, closing angle. 90 degree, normal.
Right? These are M mode pictures, very important. So if somebody is writing mitral valve prosthesis, no. You have to write normally functioning. Okay? Telu? Perfect. He is right. Is it the transesophageal lung? Yeah, he is also written correct. Transesophageal lung ultrasound, mostly used in critical care. It became very popular in COVID times. What is this? Odigo Perichet. What is it? Please speak. Please. What did you write? Correct. She is absolutely correct. If they write septal pacing, then I, sir? He is the boss. You are a participant. Sir. Dr. Mohan, you
I'm
are.
not sure that the lead is in coronary sinus actually. I don't know. No. This is okay. So you're talking LVV pacing.
LVB
That's all
pacing,
right.
yeah.
That's
So if his question is if he writes septal pacing, is it okay?
No, not septal pacing.
It is not septal pacing, sir. Septal, I think you have to be very specific.
Even his bundle pacing would be wrong. This is not the site for his bundle pacing.
Answer is
It more
LVB
like
pacing.
LVB pacing.
Yeah, correct. Good. What is it? Sorry?
Subendocardial fiber contraction.
Subendocardial fiber.
All right.
Subendocardial. The answer is subendocardial contraction. The fibers in GLS we are seeing is subendocardial. Circumferential strains tells you the subepicardial outside. The answer is subendocardial. So what is happening? Sorry? We are making it smaller. The frame rate will increase, grow up. Line density,
Increase.
increase. Spatial resolution,
Increase.
it will decrease. Temporal, increase. So first, frame rate are going high. You can see the frames are, this is going faster. Line density, higher. Spatial resolution goes down and temporal improves.
No, I
No,
think
ulta ho gaya.
spatial resolution
Ulta.
will always be better.
Spatial is
there
high.
are more lines, better spatial resolution.
So, frame
And-
rate high, line density high, spatial high, temporal low.
Temporal low.
Yeah, ulta ho gaya. Yeah. So, first three high, fourth one low. Correct? I hope you did learn something out of it. Thank you so much.